that most people, quite a number of people are suffering from allergies, and some don't know something. It's a cold, or they never give it serious attention. But I want us to learn more on allergies. What are the causes of allergies? What is allergy? How can I prevent myself from allergy? So maybe to start with that, can you define to us what is allergy and what are the main causes of allergy?
Okay, so allergies, of course, this is a big thing. It's a big topic. But specifically, if you are talking about allergies of the nose, which we call allergic rhinitis. Rhinitis is a Greek word which rhin is a nose. So allergic rhinitis means allergy of the nose. So for this particular talk, maybe we just specifically talk about the
allergies
of the nose, which is allergic rhinitis. So allergy means it's a hypersensitivity reaction. You're reacting, your body is overreacting to something, which is not actually dangerous. It's not dangerous to you.
Are you serious?
Yeah, because when you have allergic rhinitis, what you're reacting to doesn't cause any problem to other people who don't have allergies. So people who have allergies, they have hypersensitivity reactions. They get hypersensitivity reactions to the things that are going through their air when they breathe. So of course, as we breathe, there are particles, tiny particles that we can't see, but they go through the air. We breathe them. So some of these things which contain protein, the body looks at them as enemies, and then the body is trying to stop the enemy entering. So and then that is the reaction. That's the reaction you get. So for the nose, if you have allergies of the nose, if you breathe air that has those particles that you react to, then you get a reaction. And the symptoms you get are based on this reaction. Before we go to the symptoms, you need to know what are these particles that are causing reactions to people. So there are four common allergens. We call them allergens, the particles that are going to cause allergies in the nose. One are dust mites. Dust mites are very tiny, you can say insects, which live most of the time in the house. They enjoy dust, they thrive on dust. So the more dust you have in the house, the more dust mites you're going to have. Two are molds. Molds could be damp walls or could be things that you have kept in the room for long without moving. They are going to accumulate molds. So some people react to molds. Three is droppings from cockroaches. Some people react to droppings from cockroaches. And four, pollens. So those are the four common causes of allergies in the nose. There are others, but which are not common, like fur from dogs or cats, pets. Maybe at the moment I see many people with pets. Maybe we are going to start seeing some of them who are reacting those kind of pets. So, but those are the common, those are the universal causes of allergies in the nose. Now, for symptoms.
No, before you go there.
Yeah.
For someone listening or watching us right there.
Yes.
What are some of the things that they should do inside their rooms, inside their living rooms? Because you've talked about the four factors, and when I listen to them, I feel like everything you talked about, we have them in our homes. We have things we rarely move from that place to another. Sometimes these rodents come to our homes, they're inside our rooms. Sometimes the cockroaches you talk about, you're just walking in the house and you come across a cockroach, however clean the house might be,
Yeah.
You might come across it. So, what are some of the things or tips or advice that you can give someone watching us right now to clean or to do inside their homes so they can have a reduced maybe interference from allergies?
Yeah. So when we are looking at treatment of allergies, the first step of treatment is avoidance. You need to avoid things that are you're likely to react to, the 4 things we mentioned. So one, these are general recommendations. They might differ, but they are some general recommendations. One, the house should be mopped with water every day. Okay? Meaning you want to reduce the amount of dust in the house. 2, if you have carpets, either if you have allergies, we remove them, or 2, you have to vacuum them twice a week. Vacuum, not cleaning, vacuuming, because you want to remove the dust from the carpets. 3, you need to change beddings at least twice a week, because you can imagine the whole week, if you have beddings for a whole week, how much dust is in the bed. Suppose you don't mop for 2 days, you can see how much dust is on the ground.
Sure.
If you don't mop for a week, you can't even imagine.
I understand.
Yeah, so you look at the carpet, on the tiles, that you've not mopped for a week, you don't know where even to step. Then, if you use a mosquito net, you need to wash it like every 2 weeks.
Every 2 weeks?
Every 2 weeks, because it traps a lot of dust. So that dust is not nice. You are breathing it. It's going to cause problems. So you need to reduce, especially in your bedroom, the amount of stuff that you are keeping in the bedroom. Better you have your bed, and that's it. If it is not possible, then whatever things you have in the room, you have to clean them.
We need to stress that more.
Yeah.
Better if you have allergies, have just your bed.
Have your bed.
No wardrobes, nothing.
If you have a closet, it's okay, but you need to clean it every week. Take out everything, clean it, return.
Wow.
Every week.
Wow.
If you don't, then you have dust in your wardrobe. You're going to, not dust actually, you're going to accumulate mold.
Molds inside.
Yeah, molds inside your clothes and.
However much it's closed or what?
No,
It doesn't matter.
It doesn't matter. So
Okay.
everything that you keep for more than a week, you're most likely to start getting molds.
Wow.
Whether it is paper or clothes or whatever you're keeping. Yeah, so we talked about the causes, but they also irritants. These are things that are going to make your allergies worse. They are not the causes, but they are going to make it worse. So, for example, drinking cold things or cold weather, strong smells or strong odors, like paints or perfumes. People are going to react to those ones. They are not the cause of allergy, but they are going to make your allergy worse. So if you're in an office with an AC, if you have allergies, you're in trouble. If you're in a dust press, the dust outside, it doesn't have dust mites, but it's going to irritate you as well because of, you're breathing a lot of dust. The other things are fumes, like car fumes or any other thing, fumes. If you work in an industry where there are a lot of fumes, then they are going to make your allergies worse.
Okay. So how can I differentiate between allergy symptoms, by the way, from the cold or maybe sinus? How do I differentiate the two?
So the symptoms of allergic rhinitis or allergies of the nose, one, we have congestion. So your nose feels congested. You start getting watery mucus coming from your nose. You start sneezing a lot. And then your nose starts itching. Okay, so those are the 4 cardinal symptoms of allergies. So So it's congestion, mucus. You get running nose or mucus. You start sneezing much, and then you have itchy. Your eyes are itchy. I mean, nose or eyes. Sometimes they go, both of them.
How about
So-
the
Yeah.
sound? The sound, like the way someone speaks, sometimes changes.
So when your nose is congested, your sound automatically changes.
Okay.
Yeah. So that's the thing, because if your nose is congested, it affects the sound. It affects the sound, the resonance. We talk about sound resonance. The voice resonance is